you who have been For those of you who have been on this journey with us from the start, you know that we're kind of in the middle of a PDSA or Plan, Do, Study, Act cycle, a test of change related to trying to create a geographic landscape of service providers in Contra Costa County. So we'll spend a little bit of time talking about how that's going, as well as what else we've done in 2023. And sorry about my voice. Of course, it just goes out when I start talking. We are joined by Bay Area Legal Aid, and they're going to share a little bit about the services that they provide and the work that they do. So we have that as a community spotlight. And then we'll spend the rest of the time talking about some policy updates, what's to come starting in January in the ECM world and the community support world, as well as starting to think about CPI for next year. So what does CPI look like for 2024? We have a little bit of an exercise for you all to learn from you what you love about what we've been doing, what you don't love as much about what we've been doing, as we're doing some of the planning for what 2024 will look like. Next slide. So to kick it off, I would love if you guys could put in the chat or come off mute and share verbally. What is one gift you'll never forget receiving? And if you're putting it in the chat, please enter your name, organization, and if you provide ECM or community support services, or if you're a referral partner. And then if you come off mute, feel free to just introduce yourself as you're answering as well. Ryan, I'll have you kick it off. For us, if there's a gift that you have received at one point that you've never forgotten about.
That is a good question. I think so. Mine is probably it's less of a gift and more of the story behind the gift. Is I grew up in North Carolina and was very excited to get a bike one year for Christmas. It never ever snows in North Carolina. The one year that I got a bike, it snowed like 1.5 feet, so I couldn't ride the bike, but I loved it anyway. So I always remember that. Not so much the gift as it is just the story behind it. So.
Thanks for sharing, Ryan. Shelby, how about you? Anything come to mind as a gift that you will never forget receiving?
I remember my grandma got me like back when this was a thing, the original Game Boy, which is like maybe dating me, but it was like my favorite gift. I played the heck out of it. Like Mario Kart was my favorite game for like 10 years. But it was like really special because, you know, I didn't think my grandma even knew what a Game Boy was, but like she surprised me that Christmas and I thought it was so amazing.
That's fun. Thank you for sharing. Anyone else want to share? Either come off mute and share or type it into the chat.
I'll come off mute. Hi, everyone. I'm Nicole Green. I was really thinking hard about this question. I will go back to, I'm an Army brat. My mom and dad was in the Army. So one gift that came to mind was my mom would always leave for the summer to go the little Army thing. And she brought me back this little Cabbage Patch that looked like me. And it was dressed in an Army fatigue. And I kept it forever. So that was like one special gift that I can remember.
Oh, that sounds great. And what organization are you with, Nicole?
I am with Contra Costa County Office of Education, Game Plan for Success, and I work with participants that are currently in custody.
Great. Thank you for sharing. Anyone else want to share either in the chat? Emma, I see your answer. Thank you for sharing in the chat, or coming off mute.
Hi, it's Leslie. I just took myself off mute. Sure, I'll go for this. It's not so much a particular gift, but a gift theme, which was that when I was a kid, we lived in San Diego, and my grandmother, who I adored, lived in New York. So she would only come out once a year at Christmas, and she would come off the plane, and this was back in the day where you literally had to walk down the stairs. She'd come off the plane with the gifts already wrapped and in a bag, and she always, every year, had 3 gifts for each of us, something for the body, something for the mind, and something for the soul. And it just made it so special. And that's kind of my Christmas gift memory.
Thanks for sharing. That does sound really special. Okay, we'll keep going just for the sake of time. For those of you who can't think of a gift, that's okay, but I would ask that you please introduce yourselves in the chat, name, organization. just so we can know who's here, take a bit of a roll call, but also so you all can know who else is here and what organizations they're with. So these are collaborative agreements for those of you who have been a part of the CPI for a while. These will look very familiar to you. As we go into 2024, we'll reset these agreements, see if these still speak to you as a collaborative or if they're ones that we want to change or add to. But for now, these are the agreements that we have agreed on as a collaborative. I just want to take a second for you all to read these and just think for a second to yourselves if any of these stand out to you and you want to bring them into the virtual room today. We won't do a report out on it, but just want to spend a second for you to read this slide. Great, thanks, Ryan. Can you go to the next slide? So for those of you who have not been a part of the CPI collaborative before, the purpose of this collaborative is to bring together ECM and community support providers, as well as others within the system of care who are serving individuals that are eligible for ECM and community supports. So I know at this point we have a number of contracted providers, but we also have a number of referring entities or organizations that are not yet contracted for services or may never be contracted for services, but they engage with individuals eligible for ECM and community supports. We also have some MCPs on the call as well. So they're not direct service providers, but they are obviously a part of the system of care. The CPI collaboratives are a part of CalAIM, or the transformation of Medi-Cal. And the goals for CalAIM are here on the slides. For those of you who haven't joined the CPI before, if you wouldn't mind just reaching out to us in the chat, you can reach out directly to us if you don't want to let everyone know that it's your first time. We would love to set up a call with you and talk a little bit more about the CPI collaborative and what we're doing here. Next slide. And at that, I'm going to introduce Emma from Bay Area Legal Aid. Emma will provide more of an intro on the services that they provide at Bay Area Legal Aid, but they are a critical partner in the safety net landscape in Contra Costa County and in the Bay Area. They're also a great entry point for individuals that are seeking help and that are in need of different services. So they are interacting often with a lot of individuals that are eligible for ECM and community supports. So at that, Emma, I'll kick it over to you and feel free to introduce yourself and take it away from there.
Hi, it's so nice to meet all of you, and thank you for having me today. I'm excited to work more with the PATH community. My name is Emma Dinkelspiel. I am a senior staff attorney on the Health Consumer Center at Bay Area Legal Aid. We are a special sub-project at Bay Legal, which I will tell you about more in a minute, but our focus is health insurance. And Bay Area Legal Aid, as I hope all of you know, we are the main legal aid operating in Contra Costa County. We are a legal aid agency that operates throughout the Bay Area. We do at least some work in counties from all the way from Sonoma to Santa Clara. And what we offer differs by county, but in Contra Costa we are pretty full scope. We have a small but mighty office in Contra Costa County. We do housing, we do public benefits. We have a reentry practice focusing on the wraparound needs of people reentering the community from jail and prison. We have a domestic violence practice, and we have a youth team that I'm not sure whether or not we currently have an active attorney in Contra Costa County, but it's a county in which we've worked in the past and would expect to work in the future. I represent like I said, a specialty sub-project at the Health Consumer Center, which also operates in Contra Costa County as well as all of the other counties in the Bay, except San Mateo, where Legal Aid Society of San Mateo takes over. We are a primarily, or I should say, At our core, we are a hotline that provides free legal advice to people across the income spectrum. So Bay Area Legal Aid's focus, generally speaking, is on people who are low income. Our cutoff tends to be around 200% of the federal poverty line. We can provide advice to people above that if we have special grants, and we do have a couple of those operating in Contra Costa for certain housing issues. But there is a point above which we are no longer able to provide services. That doesn't apply to my work, to the Health Consumer Center. For people who are having trouble accessing their medical benefits, who are struggling with their health insurance, and ECM is very much included in all of this. We are able to assist regardless of their income or their assets. So we don't want people to self-select out of giving us a call. We can provide advice, we can provide assistance, we can provide representation, all of those things. We do a whole broad swath of health access issues. You know, Medi-Cal is obviously a major focus area for us, but we also do Medicare, we do private insurance, we do commercial insurance purchased on the exchange, we do employer insurance, we do the rare non-employer, non-exchange private insurance as well. We don't do veterans insurance so much, but we do have referrals for that. The only thing we really, have a hard exclusion on is we never take medical malpractice suits. But, anything about access to care, if you see people with large denied claims, large hospital bills, we do a lot of hospital billing work. These are all issues we can help with. We always start with, like I said, with the hotline, with advice over the phone. And I'll put that number in the chat. And that line, the Health Consumer Center line, that's open 9 to 1 Monday through Friday. We have some closures around the holiday, but for specific days, we're not closing the whole line, or we're not closing the whole time. If we, on assessing the case, decide we can provide further assistance, we will take on the case from there. Your client will sign a retainer with us, or you will sign a retainer with us, because like I said, we have no income or asset restrictions, and we will see what else we can offer in that regard. There are only 5 of us for the whole Bay Area, so we provide a lot more advice than we provide representation, just on pure numbers. But it is absolutely something that we do. For other intakes, for non-health consumer center intakes, we generally ask that people call the main legal advice line. That's I will put that number in the chat as well. That is closed for the holidays. So for people you have you're helping work with, who are maybe facing an eviction in Contra Costa County, or who have their food stamps turned off, or who are running into issues with getting a restraining order, all of which are sort of core practice areas for us. Those are all issues we can advise on once the year turns and our line reopens. That line opens at 9:30 and then closes when it's full, which is usually pretty quickly. So we really recommend that people call at 9:30, leave a message, and they'll get a call back that same day. And that's the best way to reach us. If you have an emergency referral, you are more than welcome to reach out to me directly. We tend to try to ask people to go through the hotline just because it's the easiest and most streamlined method, but there are always exceptions, especially for healthcare matters. If you'd like to send a worm referral to me, that's okay. We'll try to navigate it. That we of course we understand not everybody can use the phone. We're able to accommodate all languages. We've got a language line hookup. We do have attorneys who speak various different common local languages, but we also have an interpretation service that's able to handle. I think I've only once ever found a language that it was unable to assist with, and we ended up setting up sort of a 3-way translation line. So we do have a physical office in Richmond, and there are attorneys who work there. The Health Consumer Center is remote, but we are able to go out there for physical appointments as well. So for people who really can't be accommodated over the phone at all, that's something we can work with as well. I'm trying to think about what else I need to make sure that you guys know about. We also have a consumer team. I think this is the other big area that I think doesn't always occur to people. If you have a client who's got a big consumer debt, especially if they're being pursued by collectors, please let us know. We have these consumer clinics. I believe the one that's currently operating in Contra Costa County is out of Bay Point, and that's that also does not have a firm income or asset restriction. In that clinic, we can only represent clients who are within our income limits, but we can provide a lot of information and assistance to people who are outside of it. And we will sign people up for the clinic. They'll go through our, the general information conversation, and then they'll have a chance to sit down with an attorney, either virtually or in person, to talk about what they can do to address this debt. It's just a matter of how much assistance we can give that is gated by how much they make. So for the ECM population, anyone eligible for the ECM population is likely to be eligible for the full scope of our services. It's only really people who might fall outside of it or might be transitioning out of that. Maybe they got a new job or something like that, where you might have to keep that in the back of your mind. We also have one more restriction, which is that because we are so heavily federally funded as a legal services corporation, we do have an immigration restriction on our services. We are unable to help people who don't fall into certain status categories. We would rather get the referrals than not. It's sort of a complicated list of categories. It's not a matter of, well, if they're not a citizen, we can't help them. But the PRU-Call categories are pretty close to what we can help with. So for people who are here on an H-1B visa, for example, or for people who are here on a farm worker visa and have no other form of status, we might not be able to assist. That said, please send them our way. There's a lot of information we can provide. Okay, yeah, I see I've got some questions. So I'll start with Amy. I saw that hand go up first.
Oh, okay, thank you. So my question is just real simple. If you have somebody who their immigration status is questionable, and you work with them, is that become a public charge issue
No.
on the pathway to citizenship?
Yeah, we're not a government benefit. We are a private law firm that receives funding from various different entities. So that's a really great question. There is no risk associated with receiving legal aid. We are not a government benefit. We're just a free resource that happens to receive some government funding as a form of grant funding.
Okay, perfect. I just wanted, because that's
No, it's a great question. Right now, public charge, I mean, as I'm sure you know, and but just as a refresher for other folks, like right now, public charge is very limited. There are very few benefits that qualify as public charge. However, new administrations can meet new laws, as we all saw in 2016. And so it's good to keep an eye on what could potentially be a public charge. I don't think there's any possible construction of the law that could make us a public charge. Plus everything because we are attorneys, the mere fact of somebody being our client is confidential. We're not, we don't disclose that fact or anything they tell us to anyone else without permission. Ms. Sabayo.
I had a quick question. So typically, I'm with the Contra Costa WIC program, and sometimes we do have incarcerated individuals who are participating in our program. And they need, to get access to their benefits through a family member for their child that's at home, or if they recently had a baby and they need lactation accommodation within the jail. Do you guys assist with that, with those
I know we've done that
issues,
work.
challenges?
Yeah, I know we've done that work in Santa Rita. Whether or not we're doing that work in Contra Costa County right now is probably a matter of what current grant we have set up. So can I connect with you after this call? I'd like to put you in contact with our reentry attorney in the county who will be able to answer those questions and help you figure out.
All right, perfect. Thank you.
Yeah, absolutely. I'll send you my email.
Any other questions for Emma?
Thank you all. I'll put our phone numbers, our contact phone numbers, as well as my email address in the chat. We would also be thrilled to provide training and, information about, for example, I know Medi-Cal law is changing wonderfully but rapidly in the upcoming year. I am the outreach coordinator for my unit. I would be more than happy to provide trainings on that matter. That's a very core part of our practice. We can also provide trainings on the other things we do: housing, domestic violence, consumer law, all of those things. It's good. We're always thrilled to do that. So just reach out to me if that's something that you're interested in, and we can figure out a way to make it work. Thank you.
I have one more question for you. I'm so sorry.
No, please.
So worked out of Sonoma County, and
Mhm.
we would refer to legal aid, which I think might be you guys, but maybe not you. Anyway, to you guys
It depends.
adjacent.
Yeah.
There were rules about if it was a divorce or if it was two parties about being able to only represent one party and not the
Mhm.
other party. Do you have that same restriction?
Yes, that's a restriction that you'll find across the legal profession, really. You
Not a
know,
lawyer, so
no, it's okay. It's I just to explain how that one works. So lawyers, one of our sort of universal ethical restrictions is that we're not allowed to take on a case where there's a conflict. Meaning, if our client's interest might come into conflict with somebody else's interests, we can't represent both sides of the case. It's just a practice matter. We're just not allowed to do it. So that be representing both sides of a divorce is definitely one of the like core ones where we stay away from that entirely because the issues just become too real. More loosey-goosey issues are, like if we can represent both roommates in an eviction, for instance. We've done that in the past, but it's risky because maybe one member of an eviction case wants to move out and the other one wants to stay. And to get the best chance of that, they might need to go against each other. That's why we generally almost always only avoid one person, always represent one person on a given matter, with some very few exceptions. So if you have a couple who's looking to do an amicable divorce, and they'd like both parties to be represented, we're not the folks to talk to for a couple of different reasons. Number one, we focus heavily on domestic violence in our family law. And second of all, yeah, these conflict issues do come up. So we usually need to pick one party and work with them. I will say in the health insurance context, I regularly represent a whole family because usually there's no conflict there. Usually everybody wants coverage or doesn't want coverage, and that's no problem. So it really depends on the practice area.
so just send a referral and then
Yeah, and we'll do
let
what we
you all
can.
figure it out. Okay,
Yes, absolutely.
awesome. Thank you.
Thank you. Thank you all.
Thanks for the questions. Thanks, Emma. And Emma, as she said, we'll be putting in information in the chat. We'll make sure to share that out after the call as well. And hopefully Emma will continue to stick around and be a part of the CPI world. At that, we are going to pass it over to Ryan, or I'm going to pass it over to Ryan to talk a little bit more about what we've been doing in 2023 and then narrow in on what we're doing right now with the PDSA around a geographic landscape assessment.
I can never find the mute button when it's time to share the screen, so sorry about that. So we are going to do a very brief overview of 2023. When we look ahead to January, we're going to spend more time going into it a little bit deeper, but right now we just thought it's the end of the year. It's a good opportunity just to provide a little bit of a summary of kind of what we've been through over the past 12 months. So let's see here. Okay, so this is as you can see, a little timeline. So the CPI started back in January. So we had our first meeting then, where we used those as opportunities to kind of get to know each other, better understanding of what the CPI is, working together maybe to start brainstorming some action items that we wanted to work on as a group. As we move towards March, we took some of those action items that we came up with and developed an aim statement, which actually is on the next slide, and we'll go through that as well. But that just gave us an opportunity to really help to focus the work of the group, and give us a few parameters and goals for the year. Had our first in-person meeting in August. We did an empathy mapping exercise where we brainstormed some responses to a few different questions. Some of those included, who are we empathizing with? What do we want them to do, see? What do they say or do? And what do they think or feel? And so a lot of those responses really were focused around members and their experiences, either in your programs or what you hope their experience would be in their program. And so the feedback from from that session and that activity really helped us to identify some key concerns and priorities, which we used to transition into more of a design phase where we were starting to think about what are maybe some solutions that we can potentially work on, implement in our community to help address some of those concerns that were raised. And so we were able to kind of narrow our focus down a little bit. And so we've had 2 design sessions with 2 separate stakeholder groups. So we had a housing specific one, and we had one with MTM providers. And so, got a lot of great feedback from those that really helped with, again, kind of driving the next steps of our process. And we'll talk a little bit more about the design sessions in just a couple of slides. And then, as Danny mentioned a little bit later, we're going to do a little interactive activity. There's music involved, so that's always good. But we will think about this past year, what have been some of your experiences, and what do you hope to see for 2024? So this is our aim statement. So again, by December 31st, the Contra Costa Path CPI will facilitate engagement between providers of Medi-Cal services and MCPs to improve Medi-Cal standard systems and processes, with the ultimate goal of increasing enrollment in ECM by ECM eligible individuals by 5%, and the same with community supports. And so again, this was able to give us more of a kind of a specific focus on what we wanted to work on this year. So as mentioned earlier, the design sessions. So based on some of the feedback from the empathy mapping exercise and some of the monthly meetings, we came together around a question, a how might we question that was developed and agreed upon by the collaborative. And so that is in the green box on the left. So how might we make a geographic map of Contra Costa CalAIM services with contracted and non-contracted community supports and ECM providers to increase transparency of services and inform investments? And so we did, as part of the exercise, we did a little bit of a landscape review to identify what resources are currently out there. And so we found a lot of the resources that the group might want. They just weren't all necessarily in the same spot. And so this came out of those discussions where, folks were interested in trying to better understand what services are available, where those services might be located, how do I get someone connected to those services? And so the right side of your screen has a diagram of some of the information that providers were looking for, and some of the things that came up in our design sessions. Let's see. So as part of the design sessions, we agreed that we would send out a survey that we developed. And so the survey, there's a link here, and I'll include a link. We'll include a link in the chat as well. But the survey is an opportunity for you to provide the information from the previous slide about your program. So, if you're an ECM or community supports provider, then the information in that survey helps us understand the populations of focus, what services you provide, who the contact person is, how you receive referrals. So there's that type of information that we're trying to collect from the providers, just to better understand the landscape. And so to date, as of yesterday, we have these 5 organizations that are listed in the green box that have submitted survey responses so far. So one of the things that we wanted to talk a little bit about was, the response rate has been lower than maybe what we had expected. So maybe just some thoughts from this group around, have any of you tried to do the survey and haven't been successful? Do you have thoughts or questions maybe around why the response rate might be what it is? Just looking for feedback, because we don't want to do something just to do it. We want it to be a meaningful exercise for the group. And so if there's feedback that you have based on your experience with it, if you have, then that can help us with sort of next steps.
And just to jump in, so as Ryan said, this is really the kind of the test that was identified by the CPI as being the highest priority to work on. And so another question to ask in addition to just general feedback is this the right test? Do we still feel like this is what's meaningful and we should be moving forward and really kind of digging into? Totally acknowledge it's the end of the year. There are a lot of competing priorities, including a lot of stuff happening right now with ECM and community support. So it might be the right test. It's just a bad time for collecting information. But just curious, wanted to kind of open up the space for all to have a discussion about this and just see what your thoughts are. So feel free to come off mute and provide any thoughts or feedback. Feel free to put anything in the chat.
So are there, are there any of you who have looked at the survey and thought, nope? Or do you, just from the survey, the way it's structured, the questions, is it? Yes.
Sorry, this is not the survey that you just sent out, right?
Yeah,
The feedback about the
No.
collaborative.
It's a
that's actually
different one.
probably part of the problem, Sarah, is that there's so many surveys. Yeah, this one in particular is a survey that asks questions about the ECM community support service you provide, or if you're not a contracted provider, what other services you provide. The intent is to collect information of all of the service providers in Contra Costa County, which then will go into some sort of map, which is the next kind of iteration and design for this test of change that we're doing. What we, just quickly backing up, what we heard initially when we wanted to focus on referrals, when you all wanted to focus on referrals, what you said was before we can even start thinking about our referral processes, we need to first understand who are the service providers serving individuals in Contra Costa County and who are they serving. So that's kind of where this came from. So that's what this particular survey is that Ryan just, or will be sharing a link in the chat for.
Thank you.
Hi, this is Kevin Johnson with Modify Health. So I just started in this role in December, so I'm still learning. But is it just for ECMs or it's for community supports? I know the survey was sent out in November, but it, I suppose I could take it now if that's okay.
Yeah, for sure. We're actually going to give space to do that. But yeah, ECM supports and non-contracted providers. Basically, the idea is trying to get as many density of as many providers serving individuals in Contra Costa County as we can within the safety net or kind of the general parameters, but they don't even have to be contracted. So yeah, ECM community supports non-contracted providers.
Okay, thanks. Yeah, I'll do it.
I can stop sharing. We can put the link for the survey in the chat, and then we're thinking that we would give you a few minutes now to maybe work on completing the survey. Let me just get, if I can get the link. Shelby, do you happen to have it handy? Thank you. So the link is in the chat. We figure we'll give you about 10 minutes to complete that survey, and then we'll come back together and move to the next step.
Is it possible for us to see a list of all of the questions without going through and answering? I'm trying to figure out who in my organization I need to collect information from.
Really good question. Shelby, do we have a way to easily download that from Qualtrics and send it over?
Well, you might be overwhelmed because the questions kind of repeat on themselves if I download the entire list. But I can tell you the basic structure is that it's your organization information, so just general contact information for like your main office, like a phone number, email. And then for each service that you provide for ECM, so each population of focus you serve, and then each community support that you're contracted for. If you are a contracted provider, then you have the option to provide the contact information of the person in charge of referrals for that specific service or population. So a name, email, phone number. And again, this is sort of designed for internal purposes, so not necessarily something that you would be sharing with a member or client, but for fellow providers, this is the contact point that you might be directed to. And yes, capacity. So if you are accepting new clients for a specific service or a specific population. And so those questions sort of repeat on themselves depending on how many services or populations you check off as serving. Does that answer
thank you.
your question? Okay,
Yeah.
great.
Yeah, so just piggybacking off of that, because I'm new to this role, I don't know that I'd be able to answer all the questions that, so we can access this afterwards and I can go through with my direct report.
Yes, and you
Okay.
should be able to, stop and start in the middle. So if you run into a question you can't answer, you can use the same link to go back in and fill out the answers later.
Okay, thanks. Sorry, my dog got in there and
Find the season's hottest story.
Sorry about that. I thought I had this all figured out. How about if we give folks another 2 minutes, maybe? Thought a little winter music would be nice. Let me just get back to. Okay. All right. So hopefully that gave folks a little bit of time to work on it, depending on, you know, the numbers of programs and things like that. It could take you a little bit longer, but wanted to provide at least an opportunity just to get kind of started on it if you haven't had that chance. So what we wanted to do next was want to jump into an activity we're going to call Start, Stop, Continue. And so kind of thinking about kind of what we've done over the past year. So thinking back to that, the timeline, which we'll have up on the screen again in a minute. Oops, I did not mean to change that back. There we go. And what we want to do is spend some time thinking about what new things do we want to start doing with the CPI in 2024? What are some existing things that we're currently doing or that we have done that we should just leave in 2023? And what are some actions or things that you want to bring that we should bring into the CPI in 2024? So we haven't done them, but you think this would be really great. And so we're going to share a link in the chat. It's for a lucid chart. And I can sort of walk you through that in just a moment. So I'm going to stop sharing again for a minute. And then, let's see. Moment here, let me get this pulled up for you. And then, so this will be it's an interactive activity, basically. So, you know, we can work on it kind of in real time. Okay. So, yep, there's the link right in the chat. Thank you for that. Okay, so what we're gonna do, let me show you how we do the lucid chart and what that looks like. Our are folks familiar at all with, it's similar to like a Miro, and it's basically a virtual whiteboard. But it allows like real-time collaborations. Here we go. Okay, so what you'll see here is, so there's 3 boxes, one for start, one for stop, and one for continue. And the way that you put things in the boxes is over here on the left-hand side of your screen. You'll see a little sticky note. So you just click on that and hold it, and then you can drag it over. And then it will be, you can just add it into whichever box you want. And you can just keep doing that. You can change the color if you want to use a consistent color. But the idea is that we're going to spend a few minutes, and we'll start by spending some time individually, just putting things up there. So whatever you think of, you can put it on the board. It's anonymous for the most part. I think it gives most people like random, strange names. So whatever you put on there, and then what we can do is maybe come back together in 10 minutes, 5 or 10 minutes, and we can maybe talk through some of it as a group. And you can also resize your notes. So if you get one and you're like, whoa, that's really big or really small, you can stretch on it and make it different sizes as well. Do we have any questions? Are folks able to get into it? I see a few people in. Okay. Okay, so we'll spend just a few minutes doing that. Put on some more music, and then we'll come back together in a few minutes and talk about it. Just a couple more minutes sound good to folks? Or if you need more, you can put that in the chat as well.
Ryan checking in. Are you on mute? Are you talking on mute? Okay, there might be audio issues, but I would love to hear from folks. What's bubbling up? What are things that you're seeing or feeling that you want to start, stop, or continue? Rachel, did anything come up for you as you're thinking about things to start, stop, and continue that you want to kind of call in for the rest of the group?
Yeah, I thought that generally talking about Calium experiences has been helpful to find out what people are finding to be friction points and sort of just sharing experiences generally to figure out what others are going through so that we can see what's typical and get a better sense of what we might need to focus on that we aren't already.
Great. Yeah, thank you for sharing. Do others agree with that? Is there anything that anyone wants to add?
I just wanted to point, I would love to participate, but since it's my very first time, I didn't really put anything. I have participated in some other Cal AIM initiatives, but I wanted to kind of learn more before I gave input. So I'm still here.
Thanks for joining and for sharing that. Totally understandable. RFSD.
Hi,
Sorry, go ahead. Yeah.
hi there. Thank you. Yeah, I just I put this in the on the board, but I was using my phone, so I'm not sure if it turned out okay or not. It was a little complicated, but I just put that I think that the time for networking, especially at the in-person meetings, is really, really valuable, especially as a plan. Sometimes it's just helpful to have that time with the providers where they can just, ask questions, like in networking setting, where you can get to know one another, build relationships. So I thought just it's a great thing to continue.
Thanks for sharing. I'm seeing some thumbs up, so I think others agree. I have one question, and then Ryan, I'll let you take back over facilitation. The comment around starting data sharing discussions and lessons learned from other CPIs, I definitely agree with. For the data sharing discussion component of it, whoever wrote that, can you share more? Are you wanting to talk more about kind of ECM community supports enrollment data? Are you wanting to think more about how to share client level information more seamlessly among providers? Is it all of the above, and just starting conversations about it would be good? It looks like whoever has the magenta colors wrote it. Shubarino, if that's you, if you're guest Shubarino. Feel free to jump in, or if others have thoughts. How does data sharing discussions resonate with you, and what do you mean by that?
I didn't write this, but I give it a thumbs up. And to be honest, I'm not sure what we mean, because despite having signed the DXF thing and gotten the funding and using words like QHIO, still not really sure what any of it means.
Yeah, valid. We in San Diego County, we have a data standardization work group where, as a part of CPI, we've kind of spun off a separate group where we're digging into all things related to kind of data sharing, specific at the client level. So like client level data exchange and trying to help facilitate that. I'd be really curious if that sounds, how that sounds to folks, if that's something you would want to be a part of here, if we were to start something like that. I know time is limited, so starting another work group might not be appetizing, but it is something that we've done in San Diego and it's currently working out. Okay, so we could do that. At the very least, we can talk more about the data exchange framework and QHIOs and starting to like break down some of that language and talk about the intersection between the data exchange framework and CalAIM and how you as service providers kind of fit into that.
Yeah, as a community supports provider, I have really nothing to contribute to a work group like that. I'm just here to learn. So I'd like to learn in this group.
Yeah, sounds good. Can do that for sure.
I feel like data sharing across like the populations that some of the service providers kind of share. You know, for us as a community support program, having data sharing from, say, Kaiser, from the health plans and so forth is really helpful. Just to figure out what the disparities are within the populations, how we can kind of close some of those gaps. You know, we have so many Medi-Cal families on Medi-Cal that don't participate in the program. So if we can get data sharing to figure out ways that we can engage more with those individuals, retain them if they have kind of started on the program but fell off. So data sharing us just to even figure out what the community needs, like is our program not meeting those needs and how can we meet those needs? So that's where I feel like data sharing comes in for a program like WIC.
Cool, thanks for sharing.
Yeah, any other thoughts? What we'll do is when we send out the information for this meeting, we'll include the link for that whiteboard as well. So if you think of other things or you want to share it around, you know, we can certainly, that's available to you as well. So you're not limited to just this time. So I am going to pass it over to Shelby. Let me just share my screen again. Okay.
Yeah, so with that being said, I'm going to just briefly go over some 2024 policy updates around for the state as well as for PATH CPI that we wanted to call out as we go into 2024. So as you all are probably aware, there are 2 new populations of focus for ECM that go live January 1st, 2024. Those are the birth equity and individuals transitioning from incarceration populations. On the slide, you can see the eligibility criteria that for both of these populations, and I'm not going to read them off for you, but we will include a link to the ECM policy guide from DHCS in our follow-up. So if you want to read through the specifics around both of these populations, we highly encourage you to read through that guide. As well as it includes some information on the transition timeline. But these 2 populations do go live January 1st. To note that for the individuals transitioning from incarceration, this does not include, while this population goes live January 1st, this does not include the 90-day pre-release of services. So there is a little bit of a sticking point because the 90-day pre-release implementation date is aiming for late 2024. So there is a little bit of a interesting catch there, but these 2 populations are planning to go live for ECM services January 1st. And so to the group here, I wanted to pose the question, are there any organizations here on this call that are planning to serve these two new populations of focus for ECM? We wanted to hear from you all.
We are not an ECM provider, we're a community supports provider, but we offer a community supports program that's specifically targeted at Black and Latinx pregnant people. And we are very excited to talk to the ECM providers who will be working on birth equity so that we can get people referred to our community supports.
This is Nicole. I am not an ECM provider, but I do currently work with the justice impacted population that are currently in custody for pre and post release services.
Hi, Nicole.
Hey, Michael. See, he knows me.
Well, thank you, Sarah and Nicole, for that. Yeah, we really want to hear more from providers, not just in the ECM space, but also sort of circling around these two populations of focus. We know there's a lot of overlap in the services you all provide. So we'd love to hear, how can we, the PATH Collaborative, support you all as we're going through this transition period, this go live period? What would you like to see from us in 2024 to support you all in serving these populations? And that can be, more webinars, more community spotlights on specific providers serving these populations.
Yeah, I'd love to hear from some ECM providers.
Same as
birth equity.
Yeah. Same as Sarah for me. And also I'm here to learn, so kind of catch up on what's been done outside of the other spaces I've been in. But I would love to hear from other providers as well.
Yeah, we'll definitely take that into account. Maybe do some more direct community spotlights so we get some more providers in both the birth equity and justice involved spaces. We're looking at, CalAIM Academy content as we're going into the new year. So maybe having more educational webinars to build that foundation on both of these populations. But thank you for that feedback. Are there any other thoughts from the group?
I have one more. For me, especially with the reentry population, is really understand that roadmap of connection to services from pre and post. I don't know if it's connected to this, but I know I've been at several different calls talking about the same thing. So I'm trying to figure out the connection and how that's actually going to look when it rolls out.
Yeah, Nicole, that's a great point. And I think, as we're going in the new year, we really want to make sure that everyone who needs to be at the table is. So if you have anyone, who you're talking to on the ground who isn't, familiar with PATH CPI and who isn't involved in these conversations, we would really love to hear from you. And, if you could help bring them on board, we'd love to set up some one-on-one time with you and, any other providers that you may know of. Okay.
I have some questions related to this. You haven't done the state policy updates yet. I do have questions related to cited, so I'll go ahead and then I'll ask my questions after.
Sure. Yeah. No, let's briefly talk about some state policy and funding updates that we wanted to just call out. So for cited, round 2 awardees were announced in October. There's been so far $144 million awarded to 145 organizations. Round 3 applications are opening up in January 15th. And DHCS actually just released an application round 3 outline. And Danny, thank you for putting that outline in the chat. So if you are considering applying for cited funding, we highly recommend you go look at that application outline. It is not the official application, but it does give you a sense of all the information that they are collecting and that they would maybe ask you on the actual outline. So in advance of the application window, you can just get all of your information and, ducks in a row. So for the data exchange framework, the all-important implementation deadline for required signatories is coming up January 31st. So if you are a required signatory and you have signed the DSA, you are expected to be in compliance with all of the policies and procedures for the DXF at the end of January. If you are looking for additional funding and financial support in getting, implementation assistance, the DSA signatory grants round 3 applications close today, December 20th at midnight or 11:59 p.m. this application deadline was actually extended, so it used to be last week, but they extended it to today, given that there's been an influx of last minute applications from interested providers. So we highly recommend, if you are needing assistance with the DXF, to get your applications in the door. And grant awardees will be announced, or planning to be announced, late January to early February 2024. The Path TA Marketplace is also another opportunity for assistance for ECM and community supports. All TA recipients can access off-the-shelf and hands-on projects across all domains, regardless of your current contracting status as an ECM or community supports provider. With the caveat that if you're not currently contracted, to be eligible for support on the TA Marketplace, you have to be in conversations with an MCP to become contracted. And you can go visit the TA Marketplace website to sort of figure out what documentation you would need to prove or provide in that specific circumstance. And for that, self-service resources will be available on their website beginning January 2024. So we highly encourage you to go explore the TA Marketplace website. For PATH Justice Involved funding, eligible behavioral health and correctional agencies interested in additional funding can reach out directly to PCG. We will provide the email that you can reach out to them directly for that. But there is Justice Involved funding for eligible organizations that is on the table. And then lastly, the last policy update I wanted to call out, the 2024 MCP transitions. We've talked about this in previous PATH CPI meetings, but starting 2024, Anthem will no longer be a Medi-Cal managed care plan in Contra Costa County. It will just be Contra Costa Health Plan and Kaiser Permanente. They are definitely deep in the weeds. I can't speak to them directly, but I know that all MCPs are very much involved with the MCP transition planning right now. So DHCS has posted an entire website dedicated to transition resources for providers, for health plans, and for members. So if you have any questions, we do recommend going to their website for that. But also, if you have any questions, we can help you connect with our contacts at Anthem, CCHP, and Kaiser. If you want to, set up or ask them questions directly, we're happy to help you, get in contact with them if you're having trouble with that. I went through a lot of policy updates all at once, but I know, Michael, you have a question. We're happy to open the door now to any questions for policy updates.
Awesome. We were awarded round 2 cited funding, and I know that we had to hit all of our, we had different benchmarks that were put into place for us to be able to start drawing down any funding. We're very close to hitting our benchmarks, and I wanted to know, I believe before we can start drawing down funding, we have to submit a quarterly report that outlines what we did within our benchmarks. Do you happen to know when that quarterly reporting will go into effect? Or
Danny, is that something that you might know of? I'm not familiar with that.
Off the top of my head, I don't know. Okay. Go into effect. I'm curious if others have received cited the most recent grant.
Michael, we did, we had some retroactive funding, which was, they only considered to be January and February of this year, right?
Okay.
So we submitted a report for that, and they told us that the next reporting window would open in January.
Perfect.
So I think we'll just get an email saying the reporting window is open.
Did you submit the quarterly reporting? Was it difficult, or was it?
No, it's just like it's a short description of your milestone.
Oh, okay.
And then we just submitted like a payroll report for backup.
Got it. Perfect. That's easy peasy. Thank you.
Yeah, it's really easy if you can log in.
If you can log in. Yeah. Cool. Thank you. And then round 3, I'm assuming, I know you said to take a look at the application. Is it still capacity and infrastructure building with the same parameters for round 3? So it'll probably be that. Yeah. Okay.
Yes.
Got it.
Same parameters.
It is due on February 15th.
Due February 15th.
Do not sleep on round 3.
No. We need everything we can get, honestly, because we have a lot to do. All of us.
I put this on the Jamboard, but I would love to hear from folks. Like, I'd love to focus on this in January. because there have been 2 rounds. Like, what are people getting funded for? What are they not getting funded for? What are folks who got funded in round 1, what did they get funded for in round 2? Because we got funded in round 2 and would love to apply in round 3, but I want to make sure we have a compelling application for round 3, even though we got funded in round 2. And I know there are many orgs that got funded in both rounds, so I'd love to hear from folks who got funded in multiple rounds or who got funded for certain things or not other things, since that we're gonna have a 1-month window to apply.
One thing I was appreciative of is that they gave us even though it was for a 1-year milestone of milestones, they gave us 2 years to spend the money, right? So it's like, yeah, thank God, because we're already now behind. It's the end of the year and we're just trying to hit our milestone. So that was really helpful. And then the application, it was kind of a little bit challenging to come up with a budget and everything, but it seemed like they gave us everything we asked for, which is helpful. So
same, but yeah, I know like the grants are, from 20,000 to 5 million. So it's kind of hard to figure out like what's a reasonable number within that.
We got awarded, we just so you know, we applied for 28 staff for capacity and infrastructure building. They awarded all of it at $2.75 million. So like, we shot for the sky and we got everything we asked for.
What's your total budget? Who are you?
Contra Costa Health Services. But yeah, we have a large budget. But literally for this project, just the capacity and infrastructure building for CalAIM, it was 28 staff to be able to do the community support work that we have. And we were awarded.
Yeah. I mean, we were awarded what we asked for, but we asked, you know what, we weren't. This is really annoying. We asked for 340,000 and they gave us 320, and they told me that my director of operations should not be 50% on this project. She should only be 20%, even though she's like basically been 100% for the past year. I'm like, really? You know what my staff are doing?
They also only give you 5% indirect, which normally
I saw that.
Ours is 11.2%. So we're taking in those costs already.
Oh yeah. What do you think their indirect is? Probably 30.
Yeah. So
right.
Yeah.
Come on. Yeah, no, I would love to talk more about Cited.
Yeah, me too.
I assume they're looking at like, you say how many people you're going to serve and then how much money you want. I'm assuming they're kind of looking at a correlation there, but I don't know. I'd love to hear from more folks about what they got funded for. So we got funded, Michael, for basically 1 full-time and 2 part-time staff, plus a bunch of technology funding for CRM.
Cool.
And then when we got it, I was like, oh, we should have applied for more.
Right. And I was actually going to apply for half of that. And then I was like, you know what, this is what we really need. And I applied for all of it and got it. So
nice.
Yeah.
Yeah, well, we definitely want to call out additional funding discussions, I think, in the future, especially since funding happens to be like what we hear a lot as like the main obstacle for ECM and community supports implementation. So in the future, expect more, funding updates, conversations around funding. So we do not want to miss that. But thank you for your contributions, especially Sarah for getting Michael his answer on the application that Danny and I couldn't answer.
Thanks, team.
So let's go to the next slide, Ryan. So we did want to call out then what's going to happen with Contra Costa past CPI in the new year. We are going to stick with our Zoom meetings. We have planned out the whole year of Zoom meetings. It's going to be monthly again. We are going to stick with the registration process going through Zoom that we started with at the end of this year. And we heard in this meeting that people really want additional networking opportunities and ways to connect. So we're going to be offering quarterly in-person meetings in the new year. We plan on having them February, May, August, and November. So keep an eye out for more information about, where it's going to be, dates and times, but we just want to get those on your radar. We heard really good, feedback from our last 2 in-person meetings. It seemed like this was a really great opportunity to bring the collaborative together face-to-face and forge new connections. So there will be more next year. Keep an eye out for that information. And we're going to post the registration links as well, so you guys can have access to those. For coffee chats, our monthly coffee chats, we're kind of going to do something new. They won't be coffee chats. We're calling them Intrepid Ascent's Path CPI office hours because we're going to be combining Contra Costa's coffee chat office hours with our other county that we facilitate for Path CPI, which is San Diego. I think I saw on the Lucid chart that people were interested in hearing best practices from other counties. So we're going to hope to use this opportunity to connect providers across county lines, bring in more discussion, as well as we found that a lot of the content across both office hour or coffee chats happens to be very similar. So we hope to use this opportunity to, sort of test out a dual county office hour system. And our first office hour actually is coming up before our first monthly meeting. So keep an eye out. That's January 11th, 2024, 11 to 12. And we are planning on having more CalAIM Academy webinars on a variety of ECM and community supports topics. We haven't finalized that schedule yet, but that will be announced when that's ready. Let's go to the next slide, Ryan. So for the Zoom registration process, you all are probably familiar with it since you're in this meeting right now, but we still are getting people emailing us about their confusion about when the meetings are. They're having duplicate calendar invites on their schedules. So we just wanted to go through the registration process one more time. If you do look at your calendar right now and see that there are any 2024 Contra Costa Path CPI meeting invites, those are outdated. Please delete those off of your calendar before you do this new registration process. So I don't think we've put the links in the chat. That's great. So you can go into your calendar right now and delete any existing meetings in the new year because that's not accurate anymore. But when we do go into the Zoom link registration form that we provide, you're going to select the dates of the meetings that you want to attend. This says San Diego, but it'll say Contra Costa for you guys. You're going to put in your contact information and then hit register. And then next slide. Once you register on Zoom, you're going to get a confirmation email with all of the dates and times of the meetings that you've selected. But this is not the last step. You must click the hyperlinks underneath at the bottom of the email. That's the add to calendar. So that's going to automatically download the calendar invite information to your calendar system. So whether you use Google Calendar, Yahoo Calendar, Outlook, what have you, you must click these hyperlinks to get the Zoom information added to your calendar system. It's not going to do that automatically for you. And another thing, if we ever have to change a meeting time, like if a meeting gets canceled or moved, we're going to let you know in our monthly meetings and our office hours in our various communication channels. But it's your responsibility to update your calendars accordingly. Zoom can't do that for you. Unfortunately, that's not a way that they can. That's not a function that they have yet. So make sure that if we do announce a scheduling change, that you go into your own calendars and make that change accordingly. Are there any questions on Path CPI in 2024? No? Okay. Then I think with that, we're going to close out the meeting. Danny, I think you're going to cover the closing next steps.
Yeah, so the next steps are a repeat of what we just talked through, but make sure that you're registering in the way that Shelby just outlined for the next meetings for 2024. And as Shelby mentioned, we have them all listed out. So register for the year, so they're on your calendar. And then the office hours, January 11th, will be the first joint office hours with you all and San Diego, where you're coming together as providers, just to have an open discussion of what's working, what's not working related to ECM and community supports. We'll probably have a couple of prompting questions, but it'll be really informal, just to leave space to kind of talk and learn from each other. And then, Sarah, you mentioned earlier that there was a survey that we sent out recently. This is a survey that DHCS is asking that CPI participants fill out. It's just a survey on feedback of how the collaborative is going, so we can learn from you, similar to what we just did, but what's working, what's not. So if you can, please fill that survey out as well. And at that, I think we'll close the meeting. Happy holidays, everyone. We'll stay on for a second if anyone wants to ask questions one-on-one with us. And reach out. We're available if there are questions. Feel free to email us or Slack us. Thanks all.
Thank you.